Still, those who have not turned their camera on, I request all of you to turn it on. So before beginning, introducing you to ICS. So ICS works in two departments. First is one-to-one counseling department, and the second one is the training department. In one-to-one counseling department, we have several RCI licensed psychologists who provide counseling to the users. And in the training department, we have several psychological courses for the people who are from psychology and from non-psychology background. And today we have scheduled a demo counseling psychology session for all of you. So we want all of you to pay attention to it. It is going to be a demo class wherein you are going to learn a lot about counseling and its importance. And is going to be taken up by Akriti. She's a counseling psychologist. Again, on the last note, everybody please turn on your camera. Now we are going to start with the session.
Hello, very good evening, all of you. Hope you're all doing great. I can also see some of the familiar faces. So, hi again.
Hi, ma'am.
Hello.
How are you?
I'm good. How are you?
I'm good. I was there for your class, the first class that I took for psychology. So I'm happy to see you again after a long time.
Yeah, happy to see you too. Thank you.
Thank you. Thank you.
Hi, ma'am.
Hello, Sagatha.
Hi, ma'am. How are you? How's it been?
Good, good. All good. Thank you.
Raining there, ma'am?
Sorry?
Is it raining in your place?
No, not really. Still waiting.
It's a miracle. In Chennai, there's rain.
Lucky you, really.
2 days. Last 2 days, it's raining heavily. Yeah.
Seriously, lucky you.
Yes, ma'am. It's slightly cool now. It's not very hot.
Great,
It's great.
great, great. I really want you to enjoy the rain then.
Yes, ma'am.
All right, so we'll build a small connection with each other and then we'll go for the webinar ahead. All right, so let's introduce ourselves, right? So, since like I know a few people here and others would like to introduce yourself, right? So, I'll go with my introduction first and then you can go in. So, we always know like we start with the introduction with a small dance move, okay? And you're going to introduce yourself like any movement, not like proper dance move, right? You do a dance move, any movement, introduce yourself. Okay, what are you currently doing? Okay, and what is the purpose of joining this? Right? Cool. All right. So, like, just to make you comfortable, so I'll go first. So, here is my dance move. Hello, everyone. I'm Akriti Khosla, and I'm a counseling psychologist, expressive arts therapist, and EFT practitioner. I'm into this practice since past 9 years now. I've been also doing my work with my own organization, and here with the in ICS, I have been taking training sessions since a long time now, right? So I just hope we are going to start with another journey from here, right? Okay, so who's going next? Quick, quick, quick. It's just an introduction.
Hi, ma'am. I'm Jinsi from Madurai and working as a homeopathy doctor. So I am interested in learning psychology, so I took up this course and I'm doing it good.
Nice, nice, Jinsi. What about your dance move? Nice, nice.
Yes.
So good to
Thank
have you
you.
here, Jinsi.
Thank you, ma'am.
All right, who's going next? Since the videos are on, but others, please kindly switch on your videos. Don't hide your amazing faces behind the camera, please. Yeah. Yes, I can see three people right now. Don't worry, we are going to do take few because there are a lot of people here. And those who are not okay with it, you can put it on the chat box also. I'm giving you that option, right? All right, no problem.
Sorry, ma'am, I'm having a trouble with my speaker. That's why I was not able to hear it clearly. Sorry, right now it's clear. Can you tell me what it was, ma'am? Sorry.
Yeah, just an introduction.
Okay,
You're
ma'am.
going.
Okay, I'm Sujata. I'm living in Chennai. Currently, I'm a homemaker. I was I'm an English literature graduate and worked in Ford Motor Company for 10 years.
Mhm.
I had to take a break for my twins. So currently, I'm using this platform to have a career as well as take care of my family. And any other questions, ma'am? Sorry, I didn't get you after this.
What's the purpose of taking the course? That's it.
Yes, ma'am. This purpose of the taking this course is like actually I want to take care of my twins also because right now I'm
Mm.
finding it difficult to handle them. They are
Mm.
8 years old and both of them are very different in their character.
Mm. Right,
So this is a platform where I want to as well as handle them and have a career in it. Like
right,
okay, as a counselor too. I like to work with children. That's
right,
my that's the reason why
right.
I'm chose this platform.
Okay, thank you, Sujata. Thank
Thank you.
you. So good to have you here.
Thank you.
Okay, so we are going to start. Others, those who didn't introduce, so you can put it on the chat box. All right. Okay, so let me just present quickly. Okay, also, this will be an introduction. It's a webinar. It's an introduction to counseling psychology, what it is, how is it going to help you, what are the fields that we work in, areas of counseling psychology. So we are going to cover the aspects here, okay, and what are the future or scope in the same field. So it's just an introduction to counseling psychology that I'm giving, okay. Also about the course that the ICS is given to you, right? Okay, so first thing I want to know, like, do you have any idea about what counseling is, what counseling psychology is? Anybody, like, according to your understanding, any rough idea? You can put it on the chat box. Even if no idea, that's fine.
Good evening.
Yeah, hello, good evening.
Sorry for the delay.
No problem, Manan. Glad you have joined now.
Yeah.
Okay, so my question to everyone is, what is your understanding about counseling psychology? A rough idea about that. Okay, I'm already having a child having problem by birth or situation, knowing the problem and trying to solve that. Okay, helping others from their dilemma. All right. Okay, thank you for the responses. All right. Anybody, you can put it on the chat box. All right. So whenever we talk about counseling psychology, so it's actually a specialization, right? Where we are talking about like, where we work on multiple aspects, not just one. Okay. We also work on the psychological well-being of the individual, whether it is psychological, emotional, social, health related, physical well-being. We work on the overall aspects of that, right? So it is not just, of course, we help the person, but it is more of guiding the person, right? We are actually in the profession where we guide, but we do not suggest or advise anything, right? So it's a collaborative relationship between a client and a counselor, where you are going to work on even the minor issues, not major issues always we are talking about. Okay. Some of the minor issues could also be there. Some of the moderate issues are also there. Some of the severe issues are also there. Then it depends on what the client is coming up with, right? So it is basically we help in the overall aspect where the person is going ahead with the problem. We understand the issue, we listen to them first, we understand it, and then we help them to reflect on that. Okay. Addressing the thoughts and the emotions they are having, the issue, the pain they are having, addressing that, and then accepting, and then working upon it. That's how the process goes. The whole psychology is actually working on this principle, right? So, this is what counseling is, the process of counseling is highlighted counseling psychology, right? So, now if we talk about the key aspects, so basically we are working on the holistic approach. Okay, of holistic approach, as I told you already, that it helps to considering the individual's emotional, social, physical, psychological, all of the aspects that we work upon, right? Then developmental focus, where the person is going in the transition phases. Yeah, right. Transition phases is from childhood, from then to adolescent, then to adult, then like young adult, adult, and then the old age. These are the transitioning phases and how they are developing through that. They're developing personalities and also going ahead or facing major issues, right, through the changes. So we also address, okay, we also work upon that where they are having issues also. In case of work, in case of choosing career, in case of choosing a partner, in case of pure relations, any sort of relationships, any of the issue, so we work in overall aspect, right? So then we also work on the clinical aspects where they are having some issues like anxiety, depression. Okay, there are certain traumas also. They have relationship issues also. They have stress also. They have like, helping to manage them stress. Okay, but these are the highlighted issues that I'm telling you, right? Some crisis situations, some where they are not able to make a decision, right? Or where they have made a decision and now they are, having regret or any sort of guilt or any traumatic situation, could be anything, not necessarily a trauma is a severe, it can also be a small thing happened, it can also get converted into a trauma, right? So minor traumas to severe major traumas, right? So these are the issues that we work upon. Of course, every stage has different thing, right? Every stages have different issues. Children have different issues, very different issues. They show like some behavior issues also, behavioral developmental issues they have. And then when we talk about the teenage, so it is very different. They are developing their personality, right? So there would be personality issues as well. They would be like, making relationships or understanding about the relationships, also going ahead with like attachment issues also, attraction issues, like any could be. Then not only the issues, like the changes can get converted into the issues. Everything will not always be a issue, but yes, it can get to that level where where they are feeling that yes, there is an issue, right? So this is how we address that, right? Then of course with the different practices, it's not only we being a counselor, we have no limitation, we have various fields to work where we can practice, go ahead with the private practices, we go ahead with the school setups where we work as a school counselor, where we go ahead with the universities where we become the psychological counselor, right? Where we work in the community health centers, we also work in the rehabilitation centers, de-addiction centers, people where they are feeling like, where they have addictions, alcohol, drug addiction, substance abuse, right? And we also go ahead with the corporate setting where we go ahead with the well-being sessions, like, giving therapy or the counseling sessions to the employees, taking care of employee mental health, right? So we have various fields. We have no limitations, or we can only work in the hospital, only in the centers, community centers, only private practices. No, we can work anywhere now, anywhere, right? Okay. Uh, assessment and diagnosis, of course, they would be like, there would be some general assessment that we come up, not clinical assessments. Okay. We are not eligible to give clinical assessments, but yes, there would be general assessments that would be standardized. Okay. And also observations based, where we are observing the client, we are assessing the client and coming up with what exactly the issue is, and then working upon it. But make sure we are not going to use a clinical assessment. We are not giving any sort of diagnosis to the client. That yes, after the assessment, we get to know, oh, even if we know the symptoms, then we are actually giving the diagnosis to the person that yes, you are in depression, you have anxiety disorder, you have post traumatic stress disorder. This is the diagnosis. We are not, being a counseling psychologist, you are not eligible to diagnose a person or give any sort of medications also. Okay, I'll tell you the difference later who can do that, right? And then therapy, of course, we are eligible to give therapies, but we need to be trained in the therapies. So we can give cognitive behavior therapy. We also give humanistic therapy. There is REBT. There is also Gestalt therapy. There is also expressive arts therapy. Now, like we are using creative techniques, so that comes under art therapy, movement therapy. So there are multiple therapies, but you have to be like specialized in some of the therapies so that you can provide that where you are learning in the course about the therapies. So in the counseling session, you can give the base level therapy to them, right? What you will learn in the course, right? Then there would be career guidance also, where you are going to work with the clients, where you're giving the career, which career they need to choose about according to their interest, not just okay, like they are, like they have two career, you're giving them the options. Of course, there would be options, but yes, after observing, after knowing what they need to do, what they are interested to do, but yes, also working on the pressure they are having on the shoulders. Maybe someone has, or the family has been pressurizing to do things what they don't want to do. So we need to observe, we need to talk about it, and we need to work and give the guidance on the basis of that, right? Okay. In situation of crisis, also we give counseling where there are suicidal tendencies or the thoughts. Okay, we work upon the thought processes. There are traumas as in the person lost a loved one, where a person had an accident, where a person had an maybe like there is an abuse case, right? Had undergone any sort of abuse, harassment, anything, or maybe there is there are conflicts in the family that can also be a traumatic thing, separation of parents, anything, or any health episode, or maybe any physical change has happened, any disease has occurred, any mental health issues that has occurred earlier. So yes, it can also get converted into the crisis act, right? Okay. Now here I'm telling you the difference between a clinical psychology, a psychiatrist, and a counseling psychologist. Don't get confused here. This is very, very important. Okay. As I told you, you being a counseling psychologist, the major difference between all three is you being a counseling psychologist can assess on the general assessment basis, can give therapies, can do counseling on the observation basis, but you cannot diagnose or prescribe medication, right? Whereas in clinical psychology, being a clinical psychologist, you need to have 2 years of MPhil. You need an RCI license for that, and a clinical psychologist can give a diagnosis. Okay, they are eligible to do the clinical assessments and give a diagnosis, but not medication. Okay, only psychiatrists can give medications, they can prescribe medication. This is the highlighted difference. So if anyone asks you, this is your learning, and if anyone in future ask you or get confused, so you are in the position to educate them as well, right? So these are the major differences, right? Okay. Also, I will tell you like how and what are the qualifications that we need. That will be the later thing. So as I told you that you go ahead with the private practices where you are going also with the therapy aspects, right? Family, couple therapy, family therapy, individual therapy, group counseling, family counseling. So that whole includes in the private practice. We also go ahead with the workshops and trainings through like, individually going and applying and, conducting a workshop for organizations. So that also you're going to do in the private practice. Then education settings, college, schools, universities, some academies where the student needs guidance, right? Then healthcare facilities, clinics also, hospitals also, community centers, rehab centers, or de-addiction centers. You can go ahead and give the counseling services or the therapy services, right? Then corporates, I told you, business industries. Okay. There is also government or military where we go ahead with the community centers where they have had government services, right? Even they have any government hospitals, government schools, government community centers. So we also provide services for them as well. Okay. So as I said, there is no limitation, right? Then the client population. Okay, client population is not limited, but still you can choose, your population. So suppose, like right now, I am working as a counseling psychologist, but I have not limited myself for the population. So suppose some people only work with children. Okay, children would be your population. Some people work with only adolescents. Some people only work with adults, or some with old age. Okay, or some with only adults and old age. Okay, you can also work. But here, so suppose right now I'm working with all the population. And also I specialize in certain therapy that gives, like, that we provide services to all the population. It is not limited to one population. So you can choose later on which population interests you the most, which population you are comfortable working with, right? This is in your hands and completely your choice, right? So individuals, where we're talking about individual issues, so here anxiety, depression or depressive symptoms, stress, self-awareness or self-esteem, confidence issues are also there, life transitions are also there, relationships amongst each other are also there. So these are the individual issues that we work upon. Whereas a couple or families, when we are going working on the parenting skills or the concerns they are coming up with, marital problems, family dynamics, where they are having conflicts within the family, some family disputes or something, are not able to build relationship with each other, or maybe there is one decision maker that, because of that the whole family is suffering. Anything, it can be a problem, right? So that we need to address as a family and a couple council, right? Then there are group sessions. Group sessions mostly happen where there are, like, we go ahead with the recovery thing, where we are going ahead with like rehab centers, community centers, de-addiction centers, where there are centers. So mostly group sessions work really well. Okay. In individual practices where we are working in a group, we can also create groups with common goals, right? So that's how we target, but it should be goal oriented therapy session. Okay. So suppose if we have a five people in a group, so we work like, and one goal is they have low self-esteem issues or low confidence issues. So this would be a common goal. And then we are working and planning the structure like that, so that the activities or anything that is targeting towards the goal and everybody is benefiting from that. That's how we go ahead with the group count, right? Then there would be organizations, as I told you, like how we work with different organizations, right? This is basically the client population. Okay. I've already discussed and highlighted the issues and the interventions, okay, using different techniques. Okay. As I said, you can work as a therapist, counseling psychologist, but also, like, working as a therapist, but you can only put your tag of a therapist where you are specialized in a therapy. Okay. So suppose I put in my name, in my designation, that I'm an expressive arts therapist, because I'm a licensed one in that, right? So that's why. Otherwise, you are going ahead with a course. So with a therapy course, or suppose you have opted CBT. Okay, so you've done a course, short-term course, so you will write as a CBT practitioner that you're practicing that therapy, right? You're not going to address as a therapist because that has should have a long-term training, right? So then consultant, where you are going ahead with the employee mental health, where you are going ahead with a corporate setting. So you can work as a consultant over there or consulting psychologist, you can say, right? In hospital, in clinics also sometimes we go ahead with as a consultant, right? So on like few sessions we are taking and then like we are going to other places. So that as a consultant also. Okay. Then educator would be in schools or universities also. You also teaching and training. So right now we being an educator in ICS also, so I'm teaching also psychology. Okay, and apart from that you're going ahead with the training program in psychology or specifically teaching psychology students. So you're working as an educator. Then you're also working as a researcher, where you are going to work on the psychology research programs projects, right? You're also guiding the students, or you also yourself is a researcher coming up with new researchers, right? Then, okay, okay, specializations I already told you. You can go ahead with substance abuse, where you're going to work with the de-addiction people. You can choose your population. You want to work with de-addiction, go ahead with the de-addiction centers. Substance abuse counseling, what we say, marital and family therapy, you can choose that area and work with only family and couples, right? Or the partners, they have issues with the relationships. Rehabilitation counseling, where there are certain physical disabilities or even mental disabilities like mental retardation or any syndromes they have, mostly with physical disabilities, right? So we have rehabilitation centers for them. So if you only want to work with this population. School counseling, of course, you can go ahead with the school setups only. Then health psychology, of course, that's like when we are coming up with the chronic illnesses, mental health issues, or the disorders, or the major illnesses that we are covering. The clinical aspect also, right? But for this, you also need proper skills. Okay, you also need like how important it is for you to have a skill of a counselor, basic skills. Okay, that's what you are going to learn in the further, like, if you opt for the course. If you're already doing other courses, then you know like how the structure, how the criteria is. But in the counseling psychology, you're going to majorly learn that what are the aspects, what is counseling, how do you go ahead with the process, what are the major skills, what should be the skills of the counselor. Okay, you really need to be an active listener, empathize with the client, understanding more with the client. Okay, then only you will be patiently able to listen. You need to be more patient, right? And also how you're going to take the observations and probe questions, okay, with the client, taking the full history of the client first. Okay, not judging or not coming going to the outcome or not assuming anything. This is the whole process of the counseling, and that's how we study psychology, right? That's how we go ahead with the counseling process, because without these skills we are not going to, like, continue or should not continue further for the same, right? So these are some of the highlighted skills I told you, like active listening, empathy, trust building, trustworthiness, rapport formation, where you need to build a good rapport so the client feel comfortable and trust you more, right? And also, like, you need to be more understanding, empathizing every time with the client. We need more patience with the client. Also, like, you know also making a comfortable safe space for the client, not just like, every time you are like maybe questioning, cross questioning, but also in a very polite way, right? Not targeting things when the client is not able to in the space. So you need to give that space to the client, you need to understand, and then going ahead with further. Also structured sessions, so these all you're going to learn in the counseling course. Okay, like a proper thing, so then you are going to be eligible to be a counselor later on. Okay, but this is going to be upgrading your skills very well, practical skills, because a lot of times it is more of theory, but here, like, cases, how the cases would be, what are the issues that people come up with, then how are you going to address that. Okay, that matters. Because suppose right now, maybe like just suppose, okay, I'm a client in front of you and I'm telling you my issues, okay, and you're asking me, okay, since when it is happening, what it is. So then I'm telling you, now maybe like you can go blank after that what should I do with the person? What technique I need to do with the person? Okay. So that structure, like, you need to be prepared, but sometimes according to the person, how they are responding, we need to counsel them. We need to come up with the techniques. So that will come with practice. Okay. So these are the skills development that you're going to learn. All right. Okay. Also, when we are talking about one last thing, that when we are talking about the to become a counseling psychologist is something that you're giving a designation to yourself, right? So you for that we are going to do the master's program. For masters in psychology, that is mandatory. But here in, like, the courses that we're giving, it will help you later on, even when you pursue master, but later on when you're a counselor, you are ready to see the clients. You don't need any specialization further then. Okay. This will be a huge add-on, a highlight to your to your certificates or to your skills, where you are like, okay, you are prepared, you are ready to work with a client. So whatever the issue can come, so you know how to deal with that, how to handle that properly. Okay. So that will be the hack, and that will be the major process, the highlighted process of this, right? So this is it. This is the about counseling psychology. What is it? What are the scope, the opportunities you are going to get? I told you already how you're going to get, and even masters, like, after that also the opportunities will keep open, but you can also go ahead with your private practice later on. Yeah.
Ma'am,
So, yeah.
sorry to
Now I'll
interrupt you.
be, yes.
Ma'am, may I please ask you if, like, I am masters in clinical psychologist, in
Mhm.
clinical psychology. So, like, what I should put in, like, in front of my name, like, consultant psychologist or like counseling psychologist? What? Because I have seen others like who have completed their masters in clinical psychology. They put sometimes like consultant psychologist and sometimes counseling psychologist in front of their name, and this is how they're
Hmm.
practicing.
Right. So I would ask you to go ahead with a, like, with a psychologist name, right? Because don't use the clinical psychologist word, because as I told you that it's an RCI license that you need. You have to go further for MPhil, and then you can put a tag of after 2 years of MPhil, you can go ahead with the
Yes,
clinical psychologist designation. But here you can go ahead with the psychologist, and sometimes people do counseling psychologist after that. Use counseling psychologist after masters, because you are eligible to counsel people after
yes.
this. Yeah. So you can go ahead with the counseling psychology.
Hanji.
Okay. All right. So now I'm welcoming all the questions and doubts you have.
Ma'am, so how would I address myself now? Like,
Sorry.
how would I address myself as a counselor or myself?
Sujata, I didn't get your question. Your voice is slightly breaking.
Okay, can you hear me now, ma'am?
Yeah.
Okay, ma'am, I just want to know how would I address myself as a psychologist or a counselor psychologist, or how do I? Because I don't have a psychology background. I've done my English
Mm-hmm.
literature, so
Mm-hmm.
this is the course I'm doing. Advanced counseling course in ICS. So how do I
Mm-hmm.
address myself?
See, you can work like as a counselor, but not as a psychologist,
Okay.
right? As I said that you need masters for that. Okay. But yes, on the guidance, like, we have further, like, we have academic counselors here, those who can give you the proper pattern, how we can go and address ourselves. But here I'm just giving you an idea that this is it, this is how we address ourselves after, like, doing. But try not to be the psychologist here, because then in that case you need a proper degree for that, right?
Okay.
So, like, yes.
So just mention as a counselor.
Hmm.
Hello, ma'am. I have a question. I'm a graduate
Yes,
student.
etc. Yeah.
I want to ask you what is the difference between applied psychology and clinical psychology?
Okay, so clinical psychology is more of we are working on specifically on the clinical aspects, where we're working on the clinical disorders, clinical issues, clinical disorders as in where we are working on the OCD, obsessive compulsive disorder, schizophrenia, bipolar mood disorder, and others clinical disorders. So these are the clinical aspects where we're also working on the clinical assessments, right? So whereas in applied psychology, it is more of a research based, right? Where
Okay,
we
ma'am.
are working on the researchers in the psychology field, in the emerging psychology field, and also about the issues or the other illnesses or the issues that you are coming across.
Okay, ma'am. I did my graduation from applied psychology
Mm-hmm.
honors, and I did my internship from KGMU
Mm-hmm.
for 1 month
Mm-hmm.
in clinical psychology. So
Okay.
what can I put before my name if I have a experience of clinical psychology? But it is only for 1 month, and I am a graduate student.
You
If
are.
I want to introduce myself in an interview, what
Mm-hmm.
can I put before my name?
So right now, like you have done your graduation in applied psychology.
Yeah, an internship in clinical psychology.
So that's an internship, right? For that,
Yeah.
like addressing yourself, giving the designation, you need to like go ahead with a master's. Even if you choose
Okay.
clinical psychology masters, counseling psychology masters, then you can put a designation like, yes, I am a psychologist or I'm a counselor, counseling psychologist, right? After that. But right now, you need to share your experience with them.
Okay.
Okay.
Yes, ma'am. Thank you.
You're welcome. All right. Any other doubt? Any other queries? All clear about the field, about the areas, opportunities?
Yeah, I have a question here.
Yeah.
Basically, I am a commerce graduate with an MBA and have about 25 years of experience. I'm looking at the key aspect that I'm looking at is first the holistic approach where I intervene with students and you know, first-time job seekers, do a psychometric assessment, and be able to give them the career guidance. So, what is
Okay.
it that I would need to do to be able to step into this industry?
Okay. So you want to pursue it professionally, like you want to have the designation of the counselor psychologist, or is it like you just want to use it as on the base level?
I have my own consulting firm actually, where I help students in terms of the holistic wellness, and I
Mm-hmm.
have a financial degree,
Mm-hmm.
a certification in finance, basically a financial educator.
Mm-hmm.
So
Okay.
I just want to understand the aspects and be able to guide them.
Right. So guiding would be like, how guidance on the issues or the career guidance?
The career guidance and guide them towards personal wellness, basically.
Personal wellness. Okay. So I would ask you to like, if you are really interested in doing that or like you're going ahead with a general thing. So I think like the course will help you to go ahead with that. Even like what we are talking about right now. So that will help you to go ahead and even like that will also help you to go ahead with the career thing and also the personal wellness. So once the personal wellness is done, so automatically, the career, choosing the career or helping in the direction that will help automatically. So this will help you more
Okay, so
because
I
you're
don't
going
need.
to learn about the skills.
Thank you. So I don't need to have a master's or a bachelor's in psychology as a prerequisite.
No, as you said that you need to go ahead with a general thing. So no. But if you're going to put a tag of psychologist, then you have to like pursue it as a professional way. Then you need a master's degree in that.
Okay, that to start with, I would go with general.
Yeah.
But then, depending on the market and depending on the requirement, maybe I will be upgrading. So it's
Yes.
going to be one step at a time.
Yes, absolutely. So this would be helpful for your skill development more. So we are
Yes.
going to help through this only, right? And later on, if you plan to pursue, so you can take any time, like take a master's anytime. That would be
Okay.
your choice completely.
Because I don't have a bachelor's in psychology, so I was actually stepping back on that all this while.
Hmm. So, like even a lot of people nowadays, they have been offering the thing of masters even without being the bachelor's in psychology. Though, like I know, like how important it is to have a base of psychology, bachelor's and masters. But nowadays, like since people are already doing done their masters in different fields, want to switch the field. So that's why some of the universities are offering masters
Okay.
without a bachelor's in psychology.
All right. Thank you.
You're most welcome. All right. Any other doubt? Any other query?
Yeah,
Yes.
ma'am. Doing your diploma in counseling, can we be what you call term as a counselor?
Sorry, Sudhakar. Sorry, can you repeat?
Means by doing the diploma in counseling
Mhm.
from ICS, can we become the counselor?
You can go ahead with the counselor. Again, as I said, this is going to develop your skills more. Okay, this is more of like, working upon the skills, and you're going to work on the base level counseling. Okay, but again, do not put the word psychologist or a counseling psychologist here. Right? So you can counsel later on, because that's how you're learning. Now, that's what you're learning. You will be learning through the course, like, what are the skills, how we are going to use with people or with different population. So that's what you're going to learn throughout. Right?
Okay.
Yeah.
Means you mean to say the master has to be a compulsory to term it as psychologist?
Yes.
Without doing the what you call in the graduation, having any psychology, but only in B.Ed, like in education we have, and in M.Ed we have a papers. So with that, do
MA,
university give?
MA in different field, what you said.
Yeah, M.Ed. In Master of
MA.
Education, in B.Ed,
Mhm.
both we have the psychology papers. But that mean that you do with that base, do we get a what you call MA psychology in any of the universities?
So in that also, yes, but like, a lot of time with that, they have different criterias for that.
Yeah.
Okay, they have different criteria. So we need to, like, search for the universities, those who are offering. As I said, some of the universities offer, right? So we need to check. But I think like you've done your B.Ed or M.Ed, so that
Yeah.
should not be the concern.
I mean, can you term without base of psychology? Which are the universities offering apart from IGNO?
What are the universities? So
Yeah.
some of the universities, I can go ahead. So is it okay if the team can share some of the name of the universities?
Sure.
Yeah?
Yeah.
Would that be helpful?
Yeah.
Okay.
Sure. Thank you.
You're welcome.
Thank you.
Okay. Any other doubt? Any other query? Also, we have academic counselors in our ICS team. So you can go ahead, like, if you need some more clarity on the same, for, like how we are going to address, how you're going to, like, for the university search also. So they can help you well in the same. Okay. Yes. Paula, is it? Oh, Jennifer.
Yes.
Hi.
Hi, Akrati ma'am. Hope you're doing
Hello.
good.
I'm good. Thank you.
Okay, I have completed my BSc Psychology and MSc Psychology in distance. Though I have been graduated in mathematics, I have
Mhm.
completed my distance education through BSc and MSc in Psychology. Now I'm doing my diploma in Child Psychology in ICS. How can I address me after completing this?
So you have done your MSc in psychology?
Yeah, both BSc and MSc Psychology I have completed now,
Both.
and currently now
Mhm.
doing my diploma in child psychology in ICS.
Mhm. Okay. So you can address yourself as a counselor since you are done with your MSc. Since you're
Okay,
done with both the things, so you
yeah,
can
okay,
very well address yourself as a counseling psychologist or a psychologist.
okay, ma'am. So then I have a doubt that after completing this course, how can I go for the school counselor in ICS school?
Yes, of
Can I,
course.
can I try?
As a school counselor, na, in a school
Yes,
setup.
yeah. Yes, ma'am.
Of course you can. Of course you
Okay,
can. Since you
thank you,
already
ma'am.
have the qualification, so you can. And also like ICS you have done, I remember. Of course, you're done,
Yeah.
right, with the course. So that would be the add-on thing, the certificate for you. That would be add-on,
Okay, okay,
right?
ma'am. Thank you. Thank you for the doubt.
Okay,
Clearing.
okay. No problem. All right. Anybody have any other doubt? If not, then we are closing.